The procedure I chose is a Le Fort 3 fracture repair. A Le Fort 3 fracture repair is the use of wires to reduce a midface fracture to allow it to heal and restructure the face. Patients who need this are patients who have transverse midface fractures. This procedure is done in the supine position with a headrest, foam headrest behind the patient's head. PrEP solution is just an antiseptic solution that is used on the face and inside the oral cavity, and the only drape that is used is a half sheet. Some anatomy that is identified in this procedure is the maxilla, the zygomatic process, the nasal cavity, the oral cavity, and the eyebrows. For this procedure, the surgeon will first make an bilateral eyebrow incision to expose the infraorbital area and the frontal suture lines of the zygomatic process. Then row forceps will be placed intranasally and intraorally to reduce the maxilla, and after that, holes will be drilled on each side of the fracture of the infraorbital rim, and also holes will be drilled on the frontal sides of the zygomatic process after the zygomatic fracture has been reduced. Then stainless steel wires are passed through the holes. They are twisted in a downward clockwise fashion to keep the reduction in place, and then a suspension wire is passed through the eyebrow incisions, and it is then put into the oral cavity using a brown fascia needle. And then after that, a pull-out stainless steel wire is looped through that suspension wire, and it is pulled through the skin at the hairline, and it is tied down to a sterile polyethylene button and foam padding. Also, due to whatever the surgeon's preference is, they may use some small compression plates and screws and even bone grafts if necessary. And then after this is done, the incisions are closed, the nasal fracture is reduced, and the procedure is done. Another instrument that I didn't mention earlier that may also be used is the periosteal elevators. Some risk factors in this procedure are SSI. SSI is always a risk factor. The airway may become compromised due to hemorrhage and swelling, and your visual identity may not be fully restored, and further procedures might be needed for that. My question for you is, what instrument is used intranasally and intraorally to reduce the maxilla?